Hello, I'm very glad to be speaking with you today. I want to tell you a story of Project Echo, which began in my community in New Mexico and now is deployed in countries all over the world. In 2003, I was on the front lines as a gastroenterologist trying to serve 28,000 hepatitis C patients in New Mexico. I had the only dedicated hepatitis C clinic in the state, and my wait was 8 months long. People were dying from cirrhosis and liver cancer while waiting for treatment. We could not save their lives because the right knowledge did not exist at the right place at the right time. And that's why I started Project Echo. We started enabling primary care clinicians to set up hepatitis C treatment centers across New Mexico. We shared our treatment protocols with them, and we all connected once a week on video to discuss cases with each other. The program worked. Soon, all the primary care clinicians had become experts. The wait in my clinic fell to 2 weeks, and tens of thousands of patients got treatment where they lived. We knew we had an effective model, so we began training other academic medical centers around the world to use it for many other diseases. The ECHO model is designed to quickly scale learning so we can dramatically reduce the time to implement new medical best practices. In ECHO, all teach and all learn. It works like this. Teams of experts at regional medical centers use one-to-many video conferencing to engage with local healthcare providers in weekly ongoing knowledge sharing, case-based learning, and telementoring. And when the local experts and providers learn from each other, everyone's knowledge is constantly improving. Today, we have 684 hub partners for 52 disease areas and learners in 179 countries. And we have strong evidence that patients who receive care from an echo provider can get the same quality of care as if they went to an echo specialist. Over the last 2 years, the world has experienced the greatest health crisis of the last century. We learned that Project Echo could be put to work in a very meaningful way in a pandemic. And we learned that we can scale rapidly and massively when there's the need and the opportunity. Together, we and our partners responded to the pandemic, deploying our entire global network to meet the challenges of COVID-19. We scaled up quickly throughout Africa and in other low and middle income countries around the world. We also launched new programs with the World Health Organization and ministries of health in countries like Kenya, Cote d'Ivoire, Zambia, Namibia, India, and more. And since the start of the pandemic, ECHO has logged more than 2.5 million attendances, representing close to 1 million health workers who have impacted the lives of more than 50 million people. But we can do so much more. The pandemic has laid bare the massive imbalance in healthcare for billions of people in the poorest countries around the world. During the pandemic, countries around the world experienced massive and catastrophic loss of life as they scrambled to respond. Governments saw that they did not have the tools to deliver healthcare and the really complex medical knowledge required at scale. Now, governments around the world are rethinking how they can provide healthcare to their constituents. And we believe we have an unprecedented window of opportunity to provide a new platform for rapid and massive health system strengthening. Lockdowns and disruptions have made access to care for chronic conditions more difficult than ever, and the world's health system are straining and struggling. Progress towards eradicating killers like TB and hepatitis C, halting HIV and cancer, and stopping childhood diseases like measles has been disrupted. In India, the suicide rate is one of the highest in the world, and its mental health system is stretched to the brink. Millions of healthcare workers need the right knowledge at the right place at the right time and training to meet these and other emerging challenges. The clock is ticking, and we can help. The ECHO model can become the new operating system for health system strengthening so we can address the massive health needs of the world and prepare for future pandemics. In collaboration with you attending this meeting, we can do that. Thank you for your attention.